for the acromion process, while he's laying on his back, and the stationary arm is going to stay alongside the trunk, facing down towards his elbow. You guys see I Goni on the side. And then go ahead and flex your arm. And the moving arm is going to follow straight up his arm, or his lateral humerus. And it should be 180, and it's at 180. So you have good flexion, shoulder flexion. And then shoulder extension, you're going to want to lay on your stomach.
So now, just take note, she's measuring the other arm. So on your practical, make sure you're measuring the same arm, right?
Okay.
You're fine, you can do it there because we're all set up videotaping it, so you want to do it on the same side.
Okay, so you're going to be in the same positioning on the acromion process with the stationary arm down his trunk. And go ahead and extend.
Rest your head to one side.
And so the stationary arm is alongside the trunk, while the moving arm is on the lateral humerus, and you are at 45 degrees, and the normal is 60 degrees for extension.
The acromion process, and then you want the stationary arm parallel to the trunk, and then you want the moving arm moving up with the humerus. So normal is from abduction, you want down from 0 to 180, and then vice versa for adduction. Okay. Joe can actually go a little more than 180, so she's at like 190. Okay, and then back first. So normal, yeah, would go from 180 down to 0, but again, because she was plus 10, it would be 190 total. For the range of motion. Yep. Perfect.
You're going to put a towel under their arm so you can have the acromion process parallel to the ground. You're going to have the shoulder abducted at 90 degrees. You're going to have flexion at the arm at 90 degrees. You want to be careful of making sure that the arm stays completely straight and it doesn't get abducted back towards the midline or further abducted towards the head. You want to make sure that the forearm stays at 90 degrees. You don't want it to go further flexed in or extended outward. So the first thing I want you to do is we're going to do internal rotation. So you're going to bring your arm down towards the table, okay, just like that. You're going to have the axis at the olecranon process with the stationary arm perpendicular to the ground. Sorry. You're going to have the moving arm follow the ulnar styloid process. Okay, go ahead. She's at 90 degrees. Normal is 70 degrees. Next, we're going to go externally rotate, and we're going to go upward towards the head, making sure that this is still in line. Axis stays in the same position, still following the ulnar styloid process. Go ahead. And we're at 98 degrees over here. That's it.
They should be at 0 and be able to go to 150. You're going to put the axis of rotation on the lateral epicondyle. So just go ahead and find it. The moving arm wants to, the moving arm wants to go on the radiostylate process, and the stationary arm should line up with the chromium process. So they should be at 0 or 180, depending on.
Okay, I'm gonna stop you
Sorry.
for a second. Sorry.
Do you wanna-
Pardon my reach. Smack you.
I was gonna do the hypermobile after I did the.
Oh, you're gonna do it? Okay, I just wanna make sure you touch it.
Okay. Okay, so line it up. And she is right at 0. And then bring them into flexion. And you can take this off. And line it up again to both. And she is at
She has big guns, she won't be at 150.
yeah, she's actually at 100 and that's why I have it separate. Sorry.
There's no forgiveness with that one. There's only one set of numbers on that gun.
Yeah. So she's actually at 140. So she's missing 10 degrees. And then to do the hypermobility, you want to roll up a towel and place it right above her elbow.
So you always measure extension, even if the norm's 0, you want to see if they have hypermobility there.
And to see if she is, probably move this up a little bit. So, lateral epicondyle. And she actually has about 12 degrees of hyperextension.
So her total range would then be 152.
152.
Alright, good job.
Okay, hold like that. And so you're going to keep your goniometer open, and your axis is going to be at the third metacarpal with the stationary arm perpendicular to the floor. And so, okay, so what are you going to do? You're going to supinate, so open your arm up, and then your moving arm is going to be following where the pen is.
You just want their elbows
Oh,
tucked
sorry.
in by their side, so that they're not twisting their
And your forearm's just gonna, your arm's just gonna follow where the pen is. And so you have about 85, which is normal. The range is from 80 to 90 for the norm. And then so go back to your normal position, and then we're gonna do pronation. So just bring it back to perpendicular to the floor, and then pronate your arm. Perfect. And so I'm gonna follow you here. You'll about 90. Yeah. Good job.
Patrick's measuring. Give him a goniometer.
Okay, cool. Do it.
So axis is going to be styloid of the ulna. Stationary arm is going to be along the ulna. Yes, thank you. I'll start shaking my quad.
Okay.
So stationary is going to be this way. Moving arm is going to be along the fifth. So
On the fifth,
metacarpal there.
then you want the axis right there.
So for extension, the norm would be 70.
Whoa, backwards. We are at about 1. Why is that saying 110? No. Minus, yeah, you're at 70. Because 110 minus.
Perfect like that.
And then you are at about 95.
80 is normal for flexion. So 70, 80. All right, for ulnar
So then
and radial.
150 total.
Ulnar In radial deviation, your axis is the capitate, which is going to be in between the two styloids. Your stationary is going to be along the midline of the forearm. Your moving is parallel to the third metacarpal. So you're not following the fingers right there. See how that's parallel to the third?
Yeah, now the finger.
Oh, I got to have more than that. Hold on. Okay.
So what is that, from the 180 mark, so you're at about 23,
Yeah,
24?
normal 30 for ulnar, and then for radial, right there, about 25, normal is 20. All right.
On the edge of the table. You usually want to put a towel underneath their femur to make sure it stays parallel, because if it's not, it kind of comes down at an angle. And the axis is the anterior portion of the patella, just kind of right here. And the stationary arm is just going to be perpendicular to the floor. And you kind of want to hold down their femur with your hand and kind of hold the goni at the same time. And go into internal for me. And you kind of want to just move this out. Normal is 45. And he is at 39. Then I always have trouble with it when you're doing it. I kind of rotate this with it. So as long as you just make sure that the stationary arm is pointing straight down, you can move the movement arm out with it.
And he said to hold his femur down, but your patients, they don't know. They know they're trying to get range of motion, so you'll see them.
Yeah, you also want to watch,
So
make
you
sure
want to
the
make sure they're
hips don't move. Yeah.
on the table.
We're getting 20 degrees this week.
Right?
He's at 36 there. And you can also have him do it prone, but I like sitting down easier because it's a little bit more natural for I think the hip foot. And prone, you can get a little bit more hip movement into it, and the femur comes off the table a little bit easier.
First, patient's going to be lying supine. The axis of rotation is going to be the anterior superior iliac spine, which you can palpate, basically your hip bones. And the stationary arm is going to be in the opposite basis. We're going to start at about a 90-degree angle, and then you're going to abduct. And this is going to be lined up bisecting the quad to the middle of the patella.
And what you'll see is they'll want to rotate so they can get more.
Sorry.
Always messing with you guys.
So like I said, bisect the quad towards the middle of the patella. And the norm on the abduction is 45 degrees. So she's 139, so 49 degrees.
That's kind of hard to tell if we're being automatic.
So this is 49, so she's above the norm. And for adduction now,
Don't
you're
even
going to...
worry about adduction.
Yeah, we come.
You don't ever test it, right?
Right,
Yeah, that's to crisscross, right?
Right on.
But you can if you want.
Patient's gonna be lying supinated. What you're gonna do is stabilize him at the trunk, which is this upper body region. Okay. You're gonna have the goniometer linear like this. What you're gonna do is put the axis next to the greater trochanter, which is about right here. You're gonna hold the.
Make sure you're on it.
You can kind of palpate and feel the little bump.
Leave your leg on the table and just internally, externally rotate your foot, and then it'll pop, protrude. You can palpate easier.
Okay, the stationary arm will be along the mid-axillary, and the moving arm will be along the femur towards the direction of the lateral epicondyle. Right, so as his trunk is stable, you're gonna flex your hip up.
You can have them bend, go ahead and bend your other knee, just it
Yeah,
helps stabilize.
he'll probably get more if he bends his arm knee too. Alright, really good. Oh, this backwards. Sorry.
Sorry, they wanted to see it again.
Alright, go ahead. Alright, so it's 90 right here. Usually you'll have to subtract from 180. Right, and for hip extension, you're gonna have the patient laying prone. So,
So what did he have for flexion?
9. He has big quads.
So for the flexion, you could have your knee bent or
No, you need to have it
your
bent.
knee bent? Okay.
Because
If it's
Otherwise
extended,
your
it's...
Oh, the norm for
Yeah,
flexion
yeah,
is
okay.
120. The norm for
120?
yeah, the norm for extension is just 30 because you can't move.
And no, none of you will have. I'll be very surprised if anybody has normal hip extension. Because
Okay.
you guys, we sit shortened anterior.
How is that considered normal then?
That's what
What's
you're supposed to have.
Coordination sucks.
Right, so the axis will be the same at the greater trochanter. The stationary arm again is along the mid-axillary, and the moving arm will be along the femur towards the lateral epicondyle. You're gonna hold him at the trunk, at the pelvis. All right, can you extend this? You're good. So 180 minus 160 is 20.
What?
Well, yeah. He has big glutes.
That's actually good though for extension.
Oh yeah.
So the big one with hip extension is make sure their pelvis stays on the table, because same thing, they'll want to lift up.
What's the norm for that?
30.
30.
Going to be in the lateral epicondyle of the knee. So you find that and put your axis there. And then your stationary arm is going to be along the midline of the femur, pointing towards the greater trochanter. And then the moving arm is going to be along the midline of the fibula, pointing towards your lateral malleolus. And so she is right at 0 degrees, and the normal for extension is 0 degrees. And then if you could just flex your knee, and then you line it up again. And then she's at about 140 for knee flexion, and the normal is 135.
Okay, so you're going to line the axis up in between your medial and lateral malleoli. And this is going to line up with your tibia in the center of the lower leg. The, hold on, let me flip this. The moving arm is going to line up with the second metatarsal, so the second toe here, which is right there. And go ahead and invert. Okay, so she has about 35, so that's normal. And then eversion, line this up again, go ahead. And she has a little under 20, so like 19, which is 20 is the norm. Okay, so then you can also do this lying down.
Okay, for this one, I'm sorry to interrupt
Oh,
you.
no,
For
go
this
ahead.
one, if you only have 5 degrees, and because when you look at the subtalar joint, that's actually your calcaneus and your navicular. So you're only looking at doing it this way, you're only looking at how much movement is between the calcaneus and the talus. So you have to be, some people you'll see they'll wrap around and try to grab the talus, and then they'll move the calcaneus on the talus. Otherwise, if you take and move the whole talus, you're really looking at the talus joint, the tib fib and the talus. I know I totally just confused you. So what I'm saying is, when she did it the other way, right, you're seeing the talus move as it sits up in the tib fib, right, from the anterior when you're in plantar flexion. When you come up into dorsiflexion, your talus kind of, it basically locks into place like a puzzle piece there. So having her in this position now, if you wrap around, if you grab that talus and you're moving the calcaneus, do you see how little movement that is? That's what we're measuring. Okay? So that's why 1, 20, and 30, and when you do it this way, it's only 5 degrees. Okay?
So for that one, you would line this up in the middle of the lower leg, stationary arm. Access is down here on the heel.
We saw 2 different ways to do it. One was if they were laying down on the table and you put your knee flexed at 20 degrees and have them plantar and dorsiflex foot. Then the other one we saw, which we liked better, was just hanging off the table. So the moving arm is going to go parallel with your pinky toe. The axis is going to be at your lateral malleolus, and the stationary arm is going to be parallel with the fibula, pointing towards the fibular head. Right here, this is lateral malleolus. Okay, so dorsiflexion, he's got about. Oh. Wait, I think I'm reading this wrong.
So neutral's 90, right?
Right. Oh yeah, so dorsiflexion, he's
Wait,
got...
hold on. Line up your stationary arm with the fibular head. Make sure that...
Yeah, it's fibular head.
Okay.
Wait, I think I did it differently.
Move it down a
little bit.
I'm sorry, all you video
There you
cameras.
go.
So go ahead. You're lined up fine.
Yeah.
But if you're going to be on the malleolus, then you're parallel to the base of the fifth. If you want to be right on it, then you drop it down. The option's yours, but you can't be up here and then try to line up on it. It's going to be parallel
Okay,
to
so
it.
just drop it.
Yes.
Okay, and that's... So he's at like 25 for dorsiflexion, and norm's 20, so that's good. And then for plantar flexion...
The norm's 50 for plantar flexion.
50? Oh yeah.
Bunch.